Medicine Unmasked is a space for honest conversations about health, healthcare, and the systems that shape both. This isn't about quick fixes, trends, or medical theater. It's about understanding how the body actually works, why modern healthcare often feels reactive instead of preventative, and why so many people were told to live with things they just don't have to. Here, we talk about biology, not blame, systems, not slogans, and medicine as a thinking discipline, not a checklist. This is a place for people who want clarity instead of comfort, context instead of hype, and responsibility instead of magic. I'm Dr. Naisha Isom, and this is Medicine Unmasked. Hi, it's Dr. Isom, and I am here with Carmen Adams, the herbalist. And tonight we're going to talk about how Big Pharma and Wellness really aren't the villains you think they are. So let's start off with, Big Pharma, I guess.
Well, clients that come to me, they have their opinions on Big Pharma. So, hello, I'm Carmen. I'm the founder of Energy Med Group. I'm a registered herbalist with the American Herbalist Guild, certified holistic nutritionist, and some other modalities under my belt. Now, keeping in mind Big Pharma, the clients that I see typically don't want to take anything that Big Pharma has a stamp on. So, as an herbalist, oftentimes a part of my conversation is safety. I would like for you to stay earth-side. So, do you have the space to discuss the medication you seem to be so adverse in taking? So it's opened the floor to their fears, so to speak. And from assessing said fears, I like to be like, okay, well, do you trust the physician that taught you this? Do you understand their why? Do you understand potentially the time frame in which they're hoping to see change? And if so, well, do you feel an alignment, yay or nay? And unfortunately, more often than not,
I was going to say it's going to be nay. I'm like, that was a pure setup. Pure setup.
Yes.
Throw the physician under the bus because you know and I know they don't have time to do all the things that you just said so nicely.
Yes.
They don't have time to explain anything.
Mm-hmm. So with that in mind, I choose to stand in the gap as far as being some level of a health translator within my scope of practice. So yes, from a holistic lens, the clients that frequent that art are afraid of Big Pharma or very angry at their practices.
And I would probably say that a lot of that is due to some misperceptions, I'm sure, about how drug reps were perceived or, coming in and out of offices and how that's changed over the years. And I was still never one who believed that physicians really did prescribe based on the gifts that they were given from these reps. However, I'm sure that was a practice. Before I came into medicine, that was a practice.
Yes.
So going back to when I was an employed physician, doing insurance-based medicine, that's what I call it. Patients still have the same attitude. I don't want to take medications. I don't want to take medications. And I think I did a pretty good job at explaining my why you should, getting people to understand what alternatives may be. However, I was very heavy into, if I believed you had a condition, this is the medication that has the evidence that you should be taking, right? And that's how I would give it. However, it was never based on, for me as a physician, any said kickbacks. Like that wasn't why it was being prescribed. It was being prescribed because I either saw it had more efficacy than some other blood pressure medication, what have you, or the evidence shows that we should start here versus starting here, what have you. So for those patients who were anti-pharmaceuticals, thinking that they were the villains, it was trying to talk them into understanding that without said medication, here are your alternatives. And I'm okay with said alternatives if you're okay with said alternatives. But it's me giving you information about here are the medications, here are the options. Again, at that time, I didn't have any other tools under my belt other than medications.
So another concept that you can keep in mind from clients from this sphere would be the fear of dependency, as well as the fear of, will that medication be available? Will I be priced out of gaining access to it? And will it potentially be leveraged in some way? Looking at the setup of our political climate, as well as other things within that vein, people genuinely fear needing something and not being able to get it, and people not caring that they aren't. For example, the cost of insulin for some individuals. Maybe it's changed throughout the years, but I've seen insulin cost more than some people's rent.
Ooh.
And with the elders, I've seen that, yes. While, again, this was a couple years ago, about 7 years ago, this was a thing, and it broke my heart. So you're telling them, yes, I would love for you to continue to follow your doctor's orders, continue to do X, Y, or Z. And they're like, well, I either pay my rent or I buy the insulin. Or they're choosing to dose themselves by taking half of what the doctor. Yeah, and that's dangerous. So us holistic practitioners can plant that seed of that's dangerous. You're not trained to do that for self, but when they are priced out, that's a whole nother conversation that's also not being had.
Right.
But I at least, well, I'm sure you
Which I think is why, again, people look at Big Pharma as the villains, like the capitalist, greedy individuals who are making all the money, and we're having to spend lots and lots of money on medications that, again, if they're afraid, they will have to be on for life. And I do see that too, where patients are, and I'm very clear, especially as I got older and more seasoned in medicine, where I'm very clear with patients on, if I say this is a medication that we're going to start, I'm saying it because I believe you're going to have to be on it for life. That would be cholesterol medication. I would tell people, if I believe that you should be on a cholesterol medication, because I don't put people on cholesterol medication just willy-nilly, I'm telling that you need it because you're going to need it for life, for prevention, before you have that cardiac event. Once you've already had a cardiac event, you're absolutely on it for life. But my goal is, once you get to the point where it's proven to be effective for prevention, this is where I'm going to tell you this is a lifelong medication until I think you don't have 10 years left to live.
Ooh, I have a question with that. So from a holistic lens, if we were to teach about, let's say, red yeast rice with CoQ10 or Google resin to be a part of that cholesterol conversation, and let's say their body positively responds to it, as a physician, would you be in the vein of, well, if it's working, keep going? Or how would you approach someone that does have cholesterol markers or other aspects where you feel they should be doing something, and that something is holistic and it's moving the needle on blood work?
Oh, even then, I was okay with people being on more natural options for their cholesterol. Like, I'm more of, show me.
Right.
I'm okay, but nice. I'm the physician who's also going to make sure that we draw the labs again. I'm okay with you doing it your way. I had people who said they're going to take celery juice for blood pressure. Okay, show me. That's where
I've heard that too. And then it's a nuanced conversation, because what else are you doing or not doing?
Not my world. So I'm going to make sure that you're sending me your blood pressure logs. You're just going to have to show me. You can't just say, I'm going to do X, Y, and Z, and then we not make sure that X, Y, and Z is happening.
Yes. Yes, we are speaking the same language there.
So Big Pharma, again, gets villainized, but at the same time, when it's necessary because we both know that there is no one way to approach something. But when that one way isn't helping, like you said, if you're not responding to the CoQ10 and the other one that...
Red yeast rice.
Well, red yeast rice is what I meant, but the other one you mentioned.
Google resin.
Don't know that one. So if you're not responding, and I, again, based on how I practice now, I'm looking at a whole bunch of other factors. And for me, it's a lot easier now to look at everything and say, we're not ready for this, or we're absolutely ready for this. Doesn't mean that we may not need to add some additional things, but if you have a heavy burden, you have an LPA, you have an elevated high sensitivity cardio CRP, and all the things, and our LDL is 300, we're gonna go on this PCSK9 PCSK9. And we're gonna start there. I'm not even looking at a statin.
Because you're trying to keep them from having a cardiovascular event.
And I'm going to say, based on all of this, this is a lifelong medication now. That's what I'm going to say. Does that mean those other things can't come into play as a way to prevent adding other pharmaceuticals? Possibly. But we're going to go what makes sense. To me, that's saying you're insulin dependent, but I don't want to give you insulin.
Doesn't make sense.
So yes, is it a very expensive drug? Yes. Is it highly effective? Yes. Would I say with all of those bad actors for a person who has a heavy cardiovascular burden, who has some plaque buildup that's moderate to severe, am I going to say take a supplement only?
And that makes me happy, because when I'm looking at an individual and I'm like, those numbers or that cascade of biomarkers look dangerous, and they're wanting a holistic approach, and then I'm teaching them, do you know what insulin does in the body? I view insulin as the key that unlocks the cell that lets in glucose, aka food. So if that key is not working, therefore the receptor site or not is blunted, or however you want to term it, that the cellular death is taking place, or other issues are taking place. So I like to paint a picture. Do you want this to keep happening? And if it does keep happening, do you think it's helping you? And if you don't think it's helping you, what do you have the capacity to make change?
Right.
What do you have the room? What conversations do you have the room to have? What specialists are you currently seeing? Who do you trust on your healthcare support team? Because again, integrative care, it doesn't have to be one or the other. The same way someone can go to you and you decide they need to be on a cholesterol medication, they could come to me and I teach them about cardiovascular supporting foods, or a nutritive approach to herbalism to support the cardiovascular system, but nothing that interacts with the medication that you've chosen to put them on. So it can work hand in hand, keep that person above ground, lessen the likelihood of a cardiovascular event. And if you get to a place where it doesn't seem like you need it, for whatever reason you may get to that place, and that human gets to benefit from it. And if you don't get to that place, that human gets to benefit from a trusted, integral MD telling you, hey, I care about you and I don't want you to have a stroke. And I feel if you don't do X, Y, or Z because of X, Y, or Z, I feel that this could take place.
But here's, even for me, we can have all this supporting evidence, right? This is where like the human part comes into play. We can have all the supporting evidence, and I know in my heart of hearts that I would feel better if they went on this particular medication. Because I don't want to see the inevitable, right? And I can't predict that when that's going to happen. However, if they are saying, I want to do this, I want to change my diet, I want to try these supplements, I want to try these herbs, I'm going to say okay. Because in the next 3 months, you get to show me and yourself what you're willing to and capable of doing.
Yes.
Before we go on a medication that I say is lifelong.
And you allow them to have said conversation, and I feel it will potentially be banter back and forth if, again, they're like, well, I think I need more time. You may say something or the other, or you may stand your ground in how you feel.
Well, it depends. So if there was a lot of, that's why it's very individualized, because if they had a lot of stressors, they had a lot of things that didn't allow them to actually move into that change or that consistency, then I'm talking about a lifelong medication. I could give you another 3 months or 2 months.
See?
That makes sense to me. But if that was the case, we're going to really address the underlying cause, so we don't have to have another conversation in another 3 months about why you couldn't do what you, and again, that's where my practice is different, because I can address the brain head on, right? Doing TMS, doing QEEG, so I know exactly what's going on and we can get you there much faster, right? I can then also recommend that you see a therapist or what have you, energy work, whatever that needs to be, so that we're not in the same place 3 months from now, saying the same thing.
Yes, complementary therapies, definitely, that can come into play. I love that approach, and it gives the patient, in your words, the opportunity to attempt holistics, see how their body responded, and if they choose to go the allopathic route, see how their body responded, and continue to make informed decisions. I'm not convincing them. I'm here to educate them and also point them in a direction if I feel that things are getting a little shaky. At the same time, it's up to the person. If they're going to take the medication, or even 100%. If they're going to make any change, we can't want it for them. It could be the most beautiful holistic wellness concepts on a piece of paper, but if it is not realistic to their living situation, it's just a pretty protocol.
And that's why I like meeting people where they are. I feel like I have a lot of tools and different modalities, and I have a lot of support individuals to allow people to pick the best tools for them. With the same goal in mind, is to be optimized.
Yes.
I'm a firm believer of being 80 and upright. We want brain intact, body intact, 80 and upright, all faculties, so that we can go beyond biology and into that centurion life. Like that's where my practice is going. That's where we want to move people. So I'm always thinking down the road. Mm-hmm. So I'm okay with giving you 3 to 6 months. Mm-hmm. to make some lives, but I'm supporting you along the way. I'm not just saying, hey, see me in 3 months.
Yes.
Yeah.
That matters. And as an MD, if you choose to have other holistic practitioners like myself, you may choose to outsource the maintenance as far as the continued conversations, the more in depth about nutrition within reason, because you don't have the time and you may not be set up that way to go down those additional rabbit holes. But if you choose to partner or collaborate with others that have devoted their education to be able to further those conversations, it's still supporting to the human sitting in front of us. And I love the fact that we're pointing out we're not at war. We both want to help the person. So let's take my experience in education, your experience in education, to potentially help this human. I don't see what's wrong with it. It's been wonderful.
I think it works very well for the patient.
Yes.
But you have to also be in a system that allows that, and insurance-based systems don't allow that. In the case that we're talking about, where this is a situation where Big Pharma is not the villain. Right? However, because of the way our medical system is set up currently, right, where insurance is the predominant controlling factor of all things.
Yeah.
It has opened the door for bad actors in this wellness space. Mm. And so I know we've talked about some more recently, and it's always an issue for me because I'm getting bombarded with people asking me about certain wellness things, or people want to do wellness things. And I'm a big believer in wellness in general. All things can be tools. And I will tell people, the first thing I will say when you bring anything to me is that everything has some utility. Mm-hmm. And all has some utility. We just have to figure out where it fits. Mm-hmm. Like, what tool are we using for what? Mm-hmm. If it's red light therapy,
yes,
it has some utility. But if we actually need M-Scope Neo or Exion, like, we're not going to get that same result with red light therapy. Recent patient with a surgical issue actually, of their thumb. Well, at least they said it was surgical. Mm-hmm. Surgical issue of their thumb joint. And, he's getting ready to have surgery. I was like, well, let's try this first. Let's try some other modality. So we do a different modality on him, and instantly after his treatment, he's able to touch his thumb without pain.
Oh, that's wonderful.
You're not going to get that with red light therapy.
True. Not immediate, not quickly like that. If you do, but I haven't seen it.
Does it have some, now that we've gotten him some
really
actual improvement in the actual functioning and the cellular aspect of his injury or situation, would it be helpful down the road? Absolutely, as a different type of therapy, but does it fit now? No. So it's always like finding the tool that fits for when it fits. Like, doesn't mean that nothing in the wellness space is meaningless. I don't look at that at all. I like the wellness space a lot. I use a lot of the tools in the wellness space myself. However, it's really helping people understand when they're supposed to use what. And that's where I feel like the wellness space is really open the door for all of the bad actors to come in and basically prey on people who aren't getting the services that they need or getting the attention they need in that insurance-based model.
Yes, and they're making claims, they're over-promising, and they're dismissing the perceived limitations that holistics can have. For example, let's see, someone with elevated or say high blood pressure, and they've read somewhere that far infrared saunas could be helpful, yet they are still in a toxic relationship where every morning starts with yelling and every evening ends with things being thrown. I'm quite positive in that environment, your blood pressure is probably going to stay a little bit elevated because your nervous system is saying, hey, danger, we need to get away. So there's a negative feedback loop that is taking place that you are not in control of. It is responding to the stimuli. So far infrared sauna, beautiful. I'm for it. But I would also like you to leave that relationship safely or go talk to someone to see if there's any way to salvage said relationship. It's a part of the conversation. But if you leave that part out and you're just throwing the next nervine tea at a person, that's doing them a disservice. Like, oh, you're stressed out, drink some skull cap. And then they're getting knocked upside their head and they're still stressed out and skull cap's not working. Well, there's a reason.
See, and I hear that story and I go directly to, and we can just help tune up your brain.
Beautiful. Maybe you'll feel clear enough to be like, I deserve love. I am worthy of love. I can handle this on my own. I can be a parent without a co-parent if that's a necessity to keep everybody safe. 1000%. Yeah. It can go hand in hand. The point of the matter is if this isn't addressed, whether you find the clarity to do so or the willpower to do so, you're only hitting half the mark.
So what I am seeing, or what I get a lot of, and I'm fortunate in the sense that I get to dabble, at least learn about what's available. Even if I don't plan on doing it, I'm learning enough to figure out who does it well, what can I do better, what can I then take on myself that I don't see is being done well at all. So for me, one of those is peptides. It has become a very interesting space, to say the least, and a very expensive space for some. It's kind of replaced functional medicine in a sense. So you had like your functional medicine individuals who were mainly doing supplements and vitamins and all the things, and having people have like $2,000 a month.
Oh my God, 12 to 15 things. And sometimes, that's a whole nother conversation. I'll share my 2 cents about that.
So we have that space where I thought that space was interesting. Not everybody.
Yeah, I understand.
But again, you have people who go and they'll learn a little bit of something and they come up with ways of using other people's modalities to treat people based on something that they picked up at a conference without having the full understanding of what and why they're doing it. So they'll order a battery of tests and then they'll have people explain the test for them. But they're having people pay an absorbent amount of money for this information because it's outside of insurance-based medicine where they're not being heard. And so you have these bad actors, and I'm not necessarily individuals. I won't even say it's individuals. I'm going to say it's opened up this wellness space for more systematic bad actors.
Yes, I agree.
And how do we help people figure out who's a bad actor in this space?
Well, first thing that comes to mind is ask questions. Someone educated in whatever topic that they are teaching you about typically welcomes questions. Someone that either has a limited understanding or can only teach from a narrow perspective will hit a wall much quicker than you think. So that would be one of my first things, while I'm also speaking from a place of someone that does know things. So the moment you say something off, I'm like, that's not how the body works. You just can't BS me through that. That's just not how the body works. So educating self. If you're choosing to rely on other people teaching you about something that you may put into your body to move the needle one way or the other, educating yourself in how the body works will help you at least get some level of a flashlight on a BSer. Now, outside of that, asking questions and educating yourself, also do your own research too. Get a second opinion. While again, if it's supplemental, your primary or other specialist may not be well versed, but we're in the information age. That person learned it from somewhere.
Absolutely. That bad system, these systems that are opening up.
I like to attempt to prove them wrong. I don't have to point it out, send them a cease and desist or anything of that nature. But if you are telling me something and I'm curious, the validity, look into it. Don't just blindly follow. That is where I feel those that do have predatory intentions, they hope that the masses blindly follow, because it's a compound. You get 1,000 people to buy something that's $50, $50,000 pretty quickly, right? Now, you teach someone that you have this particular disease process. Traditionally this herb could be used, but it has a limitation and it's a safety issue because of your diagnoses. That's not going to bring you 50,000. That'll make you integral. Maybe you'll teach them something and save them a trip to the urgent care because it messed with their digestive system or something. But that's not where the quick money is. While you can still build a reputable business where you bring in great money, but it's the quick money that people are after in the whole supplement world. It's really easy for them to take something anecdotal at best and run with it. So consider the source.
I do. For me, another one that I think it should raise a flag is anytime someone's trying to convince you that that thing fixes everything.
Oh my God, yes. That is a no-go. Oh my goodness, that blanket statement. You mean this of all things is the only thing I need?
Like gut health fixes everything. I'm like, it's important. But it's not going to fix everything. And the other thing I try to tell people, because I'll say I'm okay if you go and you ask other people or you even question what I say or how I do it. I have no problems explaining my reason for anything. And if you have some input that I don't have, please share it. What I do say to individuals is, one, make sure that the person that you are seeing has a larger toolbox, because they can only present to you what they know.
Amen.
So if they can't explain modalities that they don't do,
yes,
and explain to you why or why not those other modalities that they don't do may or may not help you, then that may not be the best person, because the only thing they can tell you is what they do. And so if you come and say, hey, that's where the research comes into play. What about this? What about this? What about this? And you get this.
Or don't worry about that. What do you mean don't worry about that? That is how the body works.
Wait, if you get that statement wrong, what do you mean don't worry about that?
Face, what? Don't worry. I've been told that, because I don't always tell people what I do, especially back in the day when I chose to do more networking things.
No, if anybody says don't worry about that, and they're supposed to be helping you, don't say anything. Literally get up and leave.
You're not wrong. But I've been told that to my face, and I'm looking at them like I'm assuming this is what you tell other people that ask you questions, but I know that is not the right answer. I can tell you a couple of bullet point reasons why that's not the right answer. I didn't do that. I just knew to not refer to them, and also not to take to heart what it is they were choosing to share with me in that moment. It wasn't my place. I'm not their supervisor. I'm not there to correct them, but it was in real time. I was like, this is it. Dangerous. I choose integrity.
All day long.
All day long. As well as staying within my scope. The moment you start talking about something that you are not educated in, if there's anyone in your vicinity that's a little more educated in that topic than you, they know off the bat, and you're now not as credible as you may have been when you walked into the room.
Correct.
So any aspiring herbalists or baby practitioners, please keep that in mind. there potentially will always be someone that knows more than you, and stay within your scope.
And that's me in this world of peptides. So I got very interested in this world of peptides and exosomes, and I needed to learn more. So I go to these conferences. I read. I go and I sit and I listen. But at the end of the day, I can think for myself. I can figure it out for myself. No one's having to tell me what peptide is necessary for X, Y, and Z, nor are they trying to explain to me that I need to use it in this sequence. Now, I will listen, just like in training, to practitioners who've been doing this for a long time. That would be foolish if I didn't. Right? It gives me a better understanding of how someone else is using certain peptides, but it doesn't give me the prescription for everybody that I see. If I don't understand how it works and who it's supposed to work for, then I don't know anything about peptides. And that to me would be dangerous. And it's also understanding which ones are legal, which ones are not legal. It's a messy world out there.
Yes.
Like one of my favorite ones is tesamorelin. I'll say what it is. One of my favorite ones is tesamorelin. However, it is an FDA-approved medication. It is not legally obtained outside of the pharmaceutical company that produces it.
There's a black market for everything.
We'll have to go on a tangent about that one day when we talk about cardiovascular stuff, because I am so into visceral fat and how it is the key, the metabolic key to health. Like it is a primary focus that we should be paying attention to. And so I bring up tesamorelin because it is out there on the market as a peptide, not legally obtained outside of the pharmaceutical company that makes it, and under the brand name of Agrifta.
Okay, specifics.
And it's a very specific drug, and I am hoping that they really figure out how to jump on the bandwagon for visceral fat, just like Novo and Lilly have done with GLP-1s. It is in the same category, if not better. It is the only drug that addresses visceral fat directly.
That's awesome.
Right? Outside of me using my device to also directly affect visceral fat in the most astronomical way.
And that is so exciting. I know you feel like a magician.
Sometimes. It's one of the best times to ever be in medicine. Like what we're capable of doing now with just the advanced technologies and medications like GLP-1s used with technology, the results we get with visceral fat are mind-blowing. Like I am still in awe.
Now, tell our listeners what can go wrong if a person doesn't address visceral fat.
Oh, it's a whole list, right? So we have increased risk of cancers. We have insulin resistance. We have increased risk of, brain decline. We have increased risk of cardiovascular disease, increased risk of poor gut health. You name it, inflammation, it all goes up. Visceral fat, not obviously, but visceral fat is the fat that surrounds our organs. It is not the fat that we can pinch and feel. It is the fat that is very difficult to get rid of with just regular diet and exercise. Hey, 3 years of data for us, we've gone off the tangent, but our 3-year data shows what we're able to do with our protocol, which is for 40 to 55% consistently. Unheard of.
That's awesome.
Agrifta doesn't even have, which is primarily for visceral fat. That is why it's on the market for the treatment of visceral fat, which is a daily injection. I'm talking about a couple treatments over a couple of months or a month.
Wow.
Within 2 to 3 months. Agrifta, you're getting half the amount of visceral fat loss in 3 to 4 times the amount of time. So we're talking about in years or a year compared to a couple months. just to get to a half or a quarter of what I'm able to do in a couple of months. However, if you don't need to lose more weight, if your weight isn't really an issue, but you still have the abundance of visceral fat, which most people do, then it's a great medication. However, it's one of those situations where, this is where the bad actors come into play, right? This is where it has opened the door for bad actors, because say your insurance says you can get a GLP-1, right? No, I'm sorry, not your insurance. Say you qualify for a GLP-1.
Okay.
You meet all the criteria, right? Novo and Lilly went and got the FDA approved, indications for weight loss. I can say how I feel about that later, but they did. And now people who would qualify for the medication based on needing it for weight loss can't get it. Not because it's not available for that indication. It's because the insurance companies say, we're not going to pay for that. But yet we want to say it's the pharmaceutical company who is making it problematic. And then because your insurance company won't approve you for the medication, what happens? Door opens for bad actors.
Yep. You get it through us.
and all the different ways of being able to do that. It happens not just with GLP-1s is like a good example of how we get to this world of like bad actors, because we, are blaming or because we are basically not able to get what we need because the gatekeepers are the insurance companies. This is basically where I'm going.
That's unfortunate.
Right. Yes, we have bad actors, and pharmaceuticals, we can say they can be, bad actors because they are gouging prices. We can say the wellness situation can be bad actors because they are also gouging prices.
Overpromising.
And then we have that dark side that opened up because people aren't getting what they need in the insurance-based medical world. Which then opens up the range for wellness, which then opens up the range for darkness. And when that happens, people aren't really focused on why. If you sit and you ask yourself, why am I not getting the care that I need? Why am I not getting the pharmaceuticals that I need? It's not the doctor or the pharmaceutical company.
It's the insurance, the middleman. So what's the solution?
The theoretical solution, yes. or the solution one can take right now.
Both. I'm curious.
So the easier one is the solution people can take right now. Solution people can take right now is understanding that they can take their own health into their own hands and actually have better outcomes if they find the right practitioners.
Yes.
Right? They can build their own healthcare team. Now, people are going to push back and say that's more expensive. Or for my type of practice where I am a direct primary care practice that doesn't bill insurance. Doesn't mean you're not supposed to have insurance, because I don't want anybody to get into a situation where they don't have coverage.
Yeah.
That is not what you want for people, but people are already doing it anyway. So if you're already not getting insurance because of the cost of it, you're now leaving your health in jeopardy. When you can easily find, and maybe not easily, when you can consider looking at a direct primary care physician who is cash-based. And the range, it ranges, which is still different than a concierge doctor who still bills insurance. Philosophically, again, I can't.
Yeah.
I cannot play into that games, and I cannot have my hand held because you don't want to allow me to draw certain labs or do certain things so that my patient can be healthy. I can't play that game. And so it allows me to operate freely for the sole purpose of making sure that that patient and myself can have the most optimal health possible. When it comes to theory, what that looks like to me is no different than what it looks like to have car insurance. Or what people would consider catastrophic insurance. I believe you should have coverage. I believe that if you go into the hospital, that you should not come out having to, mortgage off your home to pay a hospital bill. I don't believe that you should go into medical bankruptcy because of something that you couldn't avoid.
Right.
Or something that you may have contributed to. However, you still deserve the opportunity of having that healed, corrected, so that you can move on and make better decisions without having to break the bank to do it. Hospital care is expensive. I don't see that getting any less expensive. That's a whole different situation. I just know that if we do a really good job prior to you having to go in the hospital, we can avoid a lot of that. So if we do a really good job at primary care, then it's less likely that you're going to need as much hospital or specialist care.
Outside of emergencies taking place. Yeah.
So theory says if we treated insurance if we treated ourselves like we were vehicles and we paid a reasonable amount every month to leave us enough to pay for a direct primary care physician. And I'm being specific about that for a couple of reasons. Because we cut out the middleman. When I play with the middleman, my costs have to go up. I can keep my costs down if I don't have to have a medical biller because I'm doing coding. That's why concierge is very different. You have to have a biller because there's too many rules for you to keep up with. So now you got to pay somebody else. So your prices are going to have to be a little bit more. We can have a direct contract with the lab.
Very helpful.
Like I go out and I create relationships so that I can bring costs down, right? For the things that I like to use. When you do that and you pay a reasonable amount to cover yourself if something catastrophic happens. So you pay a reasonable amount to your car insurance if you were to get into a wreck. You pay a reasonable amount to your car insurance if you were to lose your engine or what have you. But they don't pay for your oil changes. They don't pay for your tire changes. They don't pay for your car to get washed and cleaned. You do that.
Yeah.
Primary care is regular maintenance when it's done right. But if you avoid us, it's catastrophic.
Oh yeah, and then when you hail in as herbalists because you have a lot going on and you're wondering what plant that God put on this earth that could fix it, I hear your sentiment, I understand your heart, but we got multiple body systems involved. Herbalism is a hammer to building a deck. So that's where integrative care comes into place. So any aspiring herbalists listening in, find you a direct primary care physician to collaborate with.
But if we paid a reasonable amount, going back, for catastrophic care, you would have enough for your direct primary care provider. You would have enough for your herbalist. You would have enough for your wellness services. But people are paying large sums every month to hold a card to essentially get denied care.
Somebody had to say it because that's what it seems like. Why am I paying? And you keep saying no.
But at the same time, people will say, why would I pay more for health care when I'm already paying health insurance? And I am very clear about the two not being the same.
1,000%.
And I just say, I understand. And I usually don't go any further, but tonight I'm gonna go a little further. What I'm saying in the back of my head is you're going to continue to pay more. You pay every month. What happens when you want to go see someone? Because the only time now you're gonna go want to see someone is if something's going wrong. What happens when you go see anybody for something that you don't feel good about? You're gonna pay more. Once you go and see someone because you don't feel good about something, you're still going to pay again because you don't feel something's right. So you're going to leave with a prescription, a lab order, imaging, a referral. What's going to happen when you go do either one of those 4 things? You're going to pay more. And with the way insurances are structured now, there's like these co-pays, these deductibles. You're having to pay a lot more than you would paying a DPC, a monthly fee or an annual fee where you now have unlimited visits. So now you've gone to this person, you paid extra for that visit, medications, labs, imaging, and a referral. Like that's worst case scenario. Like you're paying for a whole bunch of stuff. Even if it's 1 or 2 of those, you get into a situation now where where's your follow-up? A month later, 3 months later? How was that contributing to helping your outcome?
Yes.
So is it really worth the cost if it's gonna cost you more in the long run because you can't just go back to your doctor without what? Paying more. With a DPC, you pay your monthly or you pay your annual and you get to be seen unlimited amounts of times. And the best part for me is that it doesn't waste your time. So I don't actually have to go back into the office to follow up. It could be a call. It could be a text. It can be virtual. It respects your time. Because now you're still getting what you need for your health and not wasting your time.
Makes sense to me. It makes sense to me because one of the first things clients of mine will ask, well, does she take insurance? And I give them a little spiel of that.
What do you say?
Okay. I say, well, sometimes it can feel like insurance is a practicing medicine because they can tell doctors yes or no. So that is uncomfortable. Hence why I choose to network with someone that's a direct primary care. Because the insurance are definitively going to tell me no. The last thing I need to do is connect you with someone that they're also going to tell no to. We're not getting closer to where we want to go. I then share that you have more control over what you're teaching them to consider. I tell them what else? Economically, because I say you get access to her mind for a nominal fee. And I'm not saying that everyone can afford it, but the person and the knowledge that she has, it's invaluable. So I paint the picture of how much I trust you, how much I wish I could like drill a little hole and dump it into my ear and take on that knowledge I hadn't gone to school for. But the big thing is you have more control over what you choose to teach them and what they do next. And you don't just leave them stranded. You know, be like, all right, here's a medication and follow up in 6 weeks, 8 weeks, next year sometimes. Yeah. And then they're just left to fend for themselves in a sense. So I paint the picture of what they won't have to deal with, but also reiterating the fact that you are someone that they can trust, someone that's going to hear them, and that the fact that you have more control. So I paint that picture and it resonates. It just simply resonates. And I haven't had anyone push back. More often than not, they choose to sign up or they let me know when they plan to or whatever it is, they may continue the conversation with you on all that kind of stuff.
Because I think for people, it still is this issue of being a physician and what their prior experiences have been with the physician. I think it's very hard for people to really understand how different my practice is until they've actually experienced it. And then it becomes a very, very different situation. But even still, I still have patients who don't really get it because they're so trained on how it worked in the outside world or the insurance-based world where they dealt with things on their own.
You got it.
And they didn't bother. Well, it was hard to bother their doctors. Like you can, send an email or do some patient portal messaging, or your option was go to urgent care for things like, my thing is, if you let me know whatever it is that doesn't feel normal, we can at least address it before it becomes something that becomes a problem. Versus it could just be a message. Hey, I'm feeling a little bit like this, but I'm doing this for it. Okay, I may not have anything to say. I may have something to say, but at least you have the option.
Yes.
Where that's not an option in other cases. So for me, I see everything as having utility. right? There are going to be good actors and bad actors in all those spaces. And even insurance, for me, I wouldn't say it's a bad actor, but it's behaving badly.
Yes, I agree with those words.
All right, its intent can be questionable. I get that it's a business, but at the end of the day, people have to start to recognize that they have to take ownership for their own health. If they are looking for their health insurance to make sense and to take care of them, they're going to be waiting.
That's unfortunate. Even in the holistic space, we can have different modalities, whether you come for acute conversations. I can teach you 2 to 3 herbs that may be helpful for the signal you feel your body is giving you. We can speak for 2 hours where I'm able to ask additional questions. Again, I'm still teaching holistic concepts. I'm not telling you what to do. I'm finding blind spots, typically in anatomy and physiology, to help you draw conclusions. Now, the 12-month approach, that is to follow what you're choosing to implement. Is the needle moving? What are we tracking? Who are you having these continued conversations with? What are they saying, if anything? And are you having the conversations?
Are we 7 minutes? What they gonna say?
Are you repeating the labs? So, hey, go in there and be like, look, these are my previous labs. These are my next labs. I know you can pull it up on your little device. However, just some way, somehow to continue said conversation so it can take place in the holistic world. It's just with certain issues where there's a technology that's involved, such as getting rid of or addressing visceral fat. I'm just not going to lie to you. I'm going to be like, oh, so that is your concern. I have a person I would love for you to continue this conversation with. And let me know if you choose to move forward, and let me know how it works. Every person I help helps me help the next person. So even if they choose a different modality that I don't offer or a specialty, I now get their lived experience by walking alongside them.
It makes a huge difference in how people are perceiving the climate of healthcare. Right? Or the climate of wellness. And what does that really look like? I think a lot of the nomenclature, even if you want to call it in the world of medicine, is getting confusing and murky. Like, I don't know what a lot of those things mean. When I got out and I said, I'm primary care. I don't like that word either. The insurance company forced that one on us. Or I'm a provider. That's another word that got forced on us. Like, I'm not a provider, I'm a physician. I don't know what provider is, but I'm a physician. And by lumping us all together, right, whether you're a physician, a nurse practitioner, or a physician assistant, we all get lumped in together now as providers. So you don't know who you're seeing. That works for them because you go in to see a physician or you go in to see a nurse practitioner. Guess what happens? The insurance company, you're not going to be paying less because you saw the nurse practitioner or that PA, or the physician assistant. You're going to pay the same price. We're not. You don't get charged less.
Why?
Why is no one asking?
I don't know.
You don't get charged less when you're forced to see, you're assigned to a physician, but now I now only see the PA, or now only see the NP. Qualified as they may be, we are not all the same.
Makes sense. I remember I didn't see my doctor. I saw the nurse practitioner, and I got so used to them. I was the only person I saw. So when the doctor came in, I was like, oh, is such and such available? And she was like, oh, not today. And I was adverse of not really wanting to converse with her because I don't know you. I've never seen this is our first time talking here. And that's when I learned, I was like, oh, so you're her supervisor in a sense of however that looks like, because of the hierarchy or whatnot.
Nevada, not so much.
I was like, oh, okay, hello. Well, I guess I got to regurgitate everything that she would have already known. She knows I'm a crier, so you just don't look at me like I got 2 heads. But yeah.
No, that's the system that we're in. So for people, it's really important to understand or start to learn to understand what the system means. And for me, it's really about people getting healthier, really understanding what's available and what's possible and what spaces it's available in. Because it's not going to be available in a traditional insurance-based space. And for people to start getting comfortable, and I know it's uncomfortable and I know it's costly, and the climate right now is difficult financially for people, but there are ways to care for yourself, care for yourself in a real way that doesn't leave you beholden to insurance-based medicine. But you gotta be smart about it too. Because there are definitely people out there who are willing to take your money.
Yes, with a smile, and seem to be okay with this. First of all money isn't good money. And second of all, I have a conscience. Some of these things, they told you to do what? For how much? Did it work? I didn't think so. Okay, I'm sorry that you experienced that.
But then you get those patients who are gun-shy because they've gone through X, Y, and Z. Yeah. And, having the ability to, and the time to help them understand that this is a different experience. Yes. Like my practice is a different experience, like physicians under me, different experience. And I've met wonderful nurse practitioners and PAs, and it has nothing to do with being a nurse practitioner or being a physician assistant. It really is that insurance companies have decided for us. Insurance companies have decided that I have paid to be educated in a certain way. I've spent a house mortgage on my education. For me to then get in a system that tells me I can't use anything that I've learned. You mean, I cringe when I think about what's gonna happen to these residents who are coming out into an insurance-based practice and are now going to become glorified secretaries. Like, you will not be able to use the skills that you just paid for.
When I had a naturopathic physician realize that we had very similar knowledge base in herbalism, nutrition, and other holistics, there are some practical things that's out of my scope that they're clearly trained on. She said, if I would have known that, I wouldn't be $300,000 in debt. And I'll leave it at that.
Which is what I said. Why would you go back to medical school?
When you looked at me, it was like, why don't you do that? I was like, I'm not. I'm just PhD, never mind.
Because it's sad. I mean, my practice is here to help family medicine physicians see that they don't have to choose that route, right? My practice is here to, show them, essentially retrain them, because I also learned after being out and having to think about how I was trained, is that we are trained to practice insurance-based medicine. That is going to be a topic for a whole nother segment.
I look forward to seeing what's behind that door.
But it's sad that we really are spending money to be trained to practice insurance-based medicine. Insurance-based medicine is a gatekeeper. We have brains. We can think. We can reason. I can say, is this reasonable for you to do? They're saying, because we can't think really, we're gonna have to make that decision for you. So that everyone isn't getting scanned, so that everyone isn't getting this particular test, we're gonna gatekeep to keep costs reasonable. Because if we let you trained physicians make that decision, you're gonna always choose the wrong decision. Well, how about you don't worry about who pays for it. Let the patient pay for it. And if we get you out of the way, it won't cost the patient as much.
Sounds like a plan to me. Sounds like a plan to me, a vision I can get behind and don't need to go to
So how about I see the patient as a physician, bill their insurance, However, how about the patient now gets to choose to pay directly to the lab, directly to the imaging company? Why am I having to bill that under insurance? Why can't the patient just pay?
Is it because it would be cheaper?
Through insurance?
No, without insurance.
Definitely.
I mean, makes sense. $50.50 for that panel you were speaking about in another segment, which would cost $300 to $400 for someone that's either third party or layman.
I'll get my same set of labs. My basic set of labs cost me through my insurance company. When my insurance bill, it said it was like $2,000 for the labs that my baseline labs. Mm-hmm. That's what was billed to the insurance company from the lab, because I billed it under insurance because I was curious. The labs discounted rate with my insurance company brought that down to, let's say, $1,800. Mm-hmm. So these are round numbers. So $2,000 discounted $1,800 because of their contractual agreement. Mm-hmm. So now the remaining is $200. Mm-hmm. The insurance paid $10 of that, left me with a $190 bill for labs that will only cost me $35.
Highway robbery, as my grandma would say. Highway robbery.
So I do think there's a better, smarter way to be able to do this insurance situation, especially when it comes to companies who are paying an absorbent amount for people who aren't even using it. Mm-hmm. 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 Like, people have insurance and they don't even use it.
As an herbalist, and I was paying $750 a month for a family of 4, and all I needed was to take 2 small children at the time for a well check. There was no copay based on my insurance. However, that was it for the entire year. So $750 times 12. And I went twice just because I liked, at the time they were homeschooled, so I was adding to their homeschool record and, doing my due diligence as a parent to get an extra set of eyes on them. But $750 times 12 for 2 visits. Why? Asinine.
But what if it looked different? What if people saw the value? Right? I still don't. That's still a lot. But the problem, you don't even get a good visit when you do go. Yep. And you're having to pay such a large, so that's philosophically why, even though, again, I do have insurance for me and my child, because I don't want to have to succumb to an accident that's gonna have me come off a whole bunch of cash when, that's what it's there for, to kind of help as a safety net. I get that. It just costs too much to do that. Mm-hmm. In some instances, some people may be struggling just to do that, and they're choosing to then not have insurance. Mm-hmm. I see that a lot with a lot of small business owners, which is unfortunate, which is why we do our best to help small business owners as much as possible, because I know that struggle. And the last thing you need to do is go down as a small business owner. Yes. And you're like the main person.
Yes, I'll even share from the holistic space. I'm the coordinator of the Herbalists Without Borders Las Vegas chapter, and I host a weekly virtual free clinic. So I have X amount of space for me to see different clients, and I teach them about 2 to 3 herbs that may be helpful based on the chapter they are in their life. Because even though I don't take insurance because I'm in the holistic space, sometimes people they don't have the capital. So in my heart, I found a philanthropic lane that was in alignment with my vision and safety. But at the same token, those that do need to go see an MD and they don't have insurance or they're priced out for whatever it looks like, it breaks my heart. So having access to those that desire to be a free clinic community member, my goal is to continue to collaborate with consulting physicians, because we do find people that are outside of our scope. But then the next question is, well, how much is this going to cost me? Or do they take my insurance? I only have X, Y, or Z. So then I get to educate them, but also at the same time, attempt to usher them there. Usually they understand the value. It's just if they don't have money to make ends meet.
It's hard. And I will admit I am not the cheapest, nor am I the most expensive. But there's a range.
Well worth it. Every penny.
You get a whole lot. I give way.
So much. So much.
Someone's nodding. But yes, so our practice is fundamentally different and based on cutting out the middleman wherever I can so that we do save people money, so that they do have more to give to themselves and their families in more ways than just financially, right? Mm-hmm. So the biggest takeaway, I guess, for tonight in this segment is everything has some utility. Big Pharma is not the villain. Wellness isn't the villain. Insurance companies aren't necessarily the villain. However, it is time for people to take a step back and consider how are they actually caring for themselves? Because health care is not synonymous with health insurance.
And I would leave off regarding some of my lovely holistic clients and their, I guess I would say, fear of Big Pharma. They may view the likelihood or possibility of side effects that are uncomfortable with their usage. And again, go to a physician that will hear you out, that does their not own research, but additional research to see if your fears can be mitigated by going a different route, if that's the case. So again, it's continuing said conversation. So that's another thing that came to mind regarding people in the holistic space and fear is of the perception of side effects that are there. And when physicians either don't have the time or why they may not share the side effects with people, but that can take place, that's another place where trust is, I guess, takes a mark in a sense, because when they learn it on their own about potential side effects or they're experiencing it, they were told it or at least educated from their knowledge or memory, that can leave a blip in their ability to trust said physician.
That's a great point. So I am gonna speak to that a little bit, because that is a huge one that I don't get as much, but I definitely got when I was in the insurance-based practices. Patients have a fear, you're right, of side effects. And what I would say is anything can be a side effect. So if it happens to you, then that's a side effect for you. That was my way of discouraging them from reading the insert. Because there's everything on the insert. And if you're already afraid, the likelihood is that you're gonna have something come up. So if I can avoid having you read the insert and just reassure you that whatever different happens to you when you take this medication, whether it's on there or not, is a valid side effect for you.
Okay, so if it was uncomfortable enough to where they were less likely to take it, would you potentially prescribe them something else in lieu of?
Absolutely. So before we even go, so when there's fear, first thing is I don't want you to read the insert. So if anything happens, I don't care if an eyelash falls out. That is the side effect for you. Here's what I also say, because they're still afraid of it happening as if it's going to be detrimental and irreversible. And so in that same conversation, what I say is that pharmaceutical companies are not in the business of being sued.
Okay.
They are not. So there's enough data and research that says this, whatever happens to you as a side effect is not going to be permanent and irreversible. So let's start from that standpoint. Something may happen, but it's not going to be permanent or irreversible. And you have me following you. I'm not giving you something and saying, go away, don't talk to me again. Figure it out. No, if something happens, you want to say something to me so we can make some adjustments. However, taking it is not going to cause you some irreversible, damaging side effect. We can just stop it, and the side effect goes away.
I love your rationale. And I've been on the receiving end, so I'm speaking from a personal perspective. Hey, this isn't working, and it's causing me discomfort. And they told me to keep taking it and gave me something else at the same time. So But yes, that makes my heart smile to hear you reiterate that. So anybody listening in, not all white coats are created the same.
No, and I've practiced the same way. I just can practice a lot better now. But even in an insurance-based environment, I was still a very different doctor. I was still never beholden to the 7 to 8 minutes you said I could spend in the room.
Mm-hmm. I knew you were different when I shared with you herbalism, nutrition, but you also heard me speaking of anatomy and physiology. So while you may not have been trained in what I was speaking of, you were able to correlate the fact that I knew what I was talking about because I was able to speak confidently and accurately about how the body works. And then you can Google search away if you would like. I welcome that. But yes, you're someone that's you welcome feedback. You welcome people sharing their lived experiences, and you have a great way of letting them know that they're not alone. So that feels good.
I think it is scary for individuals. I know how well I was trained, right? I know how much I went through to get to where I am right now, whether it was formal training or informal training. So I know the work that I've done to get to where I am. And knowing how much information that I have and the way that I put information together, I would feel personally a certain type of way if people didn't lean in for that information, because it's not easy for people to navigate this system. It's ugly, it's tricky. You need guidance. It's problematic in finding the right guidance, and I understand that. I do. I know that what I do is different. I understand the problem that exists, so I don't discount the fact that it's hard. I used to tell people, it's hard for me to find a doctor. It's hard for me. So I know it's hard for you, and I know what to look for, and I can pretty much take care of myself.
Said very similar sentiments.
So I get the landscape is not the best, but I do know that there are great physicians and nurse practitioners even, right? In Nevada, they can practice without an overseeing physician. Mm-hmm. There are great individuals out here who are not in that insurance-based space who can offer you the guidance and who can actually be there for you through this health journey, right? And improving and optimizing. So no, we're not all created equal. And there's some great physicians even in the insured space. I was just a little handicapped. Well, I was a lot handicapped compared to what I am now. But I did have to address the fear aspect and people understanding pharmaceuticals can be stopped. The problem comes when you're not being monitored.
Or when you just stop them cold turkey, hence rebound hypertension.
Because you're not being monitored.
Yes.
Right. I know people who get their prescriptions filled without coming back.
Yes.
There's no I get the convenience, but you have to stop as an individual and think about, how is that helping me if no one's really monitoring me? How do I know that I'm okay?
I would say, what was their rationale? Why did they continue it?
Because they put 11 refills on there and just let it go.
I understand that. I'm just wondering, have you considered this?
I'm going to give you 90 days and 3 refills. I'm like, whew. But at some point, yes, even if it's a chronic medication, you require monitoring. Staying on a statin and never checking liver enzymes, just because I've told you it needs to be a lifelong medication, I still need to monitor it.
That warms my heart. That's why I can send people to you confidently, even if a pharmaceutical is a part of the conversation. Trust me, if you don't need it, she will be one of the first to tell you. willingly and on purpose. It's not going to be, oh, well, I guess you don't need it because this. And I've experienced that. Well, I guess you continue to do what you're doing because I guess it's working. Because I was a caregiver for said individual I was speaking of earlier. And before they realized that her baseline was no longer her baseline, which they told me, I would get that passive aggressive approach. Well, I guess if it's working, I don't know. But your measurable success you're saying it's working when I told you, no, we're not on that medication. Her PCP took her off because we were talking to a cardiologist at this time. They're like, oh, well, what changed? And I shared with them all the holistic things while still monitoring progress. Oh, and then the passive aggressive statement. But at first, he was gung-ho because he thought it was the pharmaceuticals. While I appreciate your confidence and your suggestion, but the route we took based on the other guidance received, this is where we now are. So that baseline you initially assigned to her is no longer relevant. And he had to swallow that. And he did so ungracefully. And that doesn't, why?
Because we are taught that quietly. It's not that someone trains you to be a certain way, but the environment really suggests that.
Makes sense.
Anything else outside of evidence-based medicine,
or I've been called a witch doctor, hocus pocus.
Because we get ingrained in our heads that if it doesn't have the type of evidence that we are trained to believe is credible, then we can't consider it as being credible. So the only thing left to say is something off-putting.
Yeah. And then I've had some that go, oh, wow, what did you take? And why did you do that? Her primary was very excited about it. Her neurologist was like, wow, she's walking, because she told me, we willed her in that is where she was.
But then it dies right there.
Yep, it went no further.
Right, it dies right there. And not because, yes, they're excited, yes, they're interested, but they don't have the bandwidth or the wiggle room to even consider it. It's like, good for you.
Yep.
Next.
Yep, that's all it was. And she's like, well, is she having any regression, anything negative taking place? I'm like, no. Okay, you had me get out in this desert heat. I could have emailed this to you.
No, because you don't get to bill if you email it. I need to bill you. I need to see you. I need to have you come down here, not, wasting your time. I feel bad for people who have any issues with walking, hearing. You don't get enough time with the physician, and they making you come out your house for no reason just to tell you lab results that you probably could have just told me over the phone. Oh, no, you can't do that because you're not going to get paid if I don't come in. Even though reimbursement isn't that great, which is why I got to see 50 of you in a day.
Oh my God, yeah.
Right? So people, my insurance, your insurance doesn't pay that physician anything.
I've had physicians.
Which is why they're employees now. Like the whole system has completely flipped. Maybe it's like that Stranger Things. Like it's the
upside down world. Maybe.
It is unrecognizable to me these days. So like, how did we get here? And people don't even know what medicine used to look like before insurance got involved. That's where we are right now.
Right.
Like people have no idea what medicine looked like before insurance got involved, to the degree that they've gotten involved.
I look forward to you changing that.
Yeah, one physician at a time.
There we go. That's what I want to hear.
Alrighty, so that is the end of tonight's segment. Please join us for other segments to come. Have a good night.